Do you get numbness or tingling on the outside of your leg or on the top of your foot? If so, this video is for you. Hi, I'm Dr. Dave Candy, owner of More for Life. And in this video, I'm going to tell you some common causes of numbness or tingling on the outside of the leg or on the top of the foot, and what you can do to relieve them. Now, if you find this video helpful, give it a like or thumbs up, and subscribe to our channel and turn on notifications so you get notified of our future videos. Now, the most common cause of numbness or tingling on the outside of the leg and or the top of the foot is a back problem, and specifically the L5 nerve, which comes out at the L5-S1 area, basically right down there in the lower back. So if you've got that numbness or tingling on the outside of the leg or top of the foot, that's the first thing that I would suspect. And most people who have that either have a current back problem or have a past back problem that has since resolved, but that numbness or tingling has stayed and has been persistent. A lot of times people are told that there's nothing that you can do, that it's been too long, that nerve is dead permanently, and sometimes that's true. But in other cases, there is something that can be done, especially if you have times where your leg feels normal or your foot feels normal and other times where it feels numb or tingly. That if it's normal sometimes, there is still a chance that it can be rescued. Now again, I would rule out the back issue, and that's a topic for another video, and we do have many things on that topic. Additionally, if you're getting the numbness and tingling down your leg into your foot, you're probably at the point of needing to have it checked out anyway. But in this video, I'm going to show you what happens if either the back problem has resolved or if there's something else besides the back contributing to that numbness or tingling in the outside of the leg or in the top of the foot. And that can come from a peripheral nerve. It's called your fibular nerve, or the old name for it is peroneal nerve. It runs right behind the back of your knee there, and one branch goes down the outside of your leg. The other branch dives deep and goes into your foot. And so if the back problem has either been taken care of through treatment or surgery or time, but you're still having some persistent tingling in the outside of your leg or the top of your foot, this exercise can help. And what you do with this exercise is sit down in a chair, you cross one leg over the other, and pull up on the lower leg bone and push out on the upper leg bone. That creates kind of a shearing force across the knee. Now, why is that helpful for numbness or tingling in the outside of the leg or the top of the foot? Well, it's because a common issue when people walk or do other repetitive activities is that they'll overpronate or that their knee will go inwards. And that can create some tension on that fibular nerve behind the knee there. So what this does is just the opposite of that mechanism of injury, is that if this is the cause of the problem, it's just the opposite of that. So you pull your lower leg bone upwards towards you, you push your upper leg bone out, and that creates sort of a shearing force across the knee to get things lined up normally and take some of the tension off that fibular nerve. Now, it's also common to get what are called trigger points or knots in the muscle on the outside of your leg or even in your calf, but particularly in the deep calf muscles that run around the nerve. There are some things you can do on your own, either through self-massage or using a rolling pin on it or even one of those foam rollers. But sometimes you just can't get to the right trigger points, or particularly in the calf muscle, you can't get deep enough to find those trigger points. So we do have some treatments here, both deep trigger point therapy as well as dry needling, that can help localize and get to some of those deeper trigger points and help you relieve even chronic pain or tingling or numbness on the outside part of your leg or the top of your foot. Hopefully you found this video helpful. If you did, give it a like or thumbs up and subscribe to our channel so you get notified of our future videos.